Chapter 34 Vaccines. Immunity comes in three different forms. There's active immunity, which is the antibodies that are produced in your body, also called natural immunity. There's also passive immunity, where they're received antibodies from another source, such as vaccinations. And then there's community immunity. Most of the community immunized against a contagious disease is going to stop its spread. When it comes to vaccinations, antigens stimulate an immune response, but does not typically produce the disease. There could be traditional vaccines where whole or components of an inactivated microorganism are introduced, or there could be attenuated virus or live virus vaccines. Toxoids are the inactivated toxins that stimulate an antitoxin formation, but can't produce the disease itself. There are conjugated vaccines, which require a protein or toxoid from an unrelated organism to link to an outer coating of a disease-causing microorganism. There could also be recombinant subunit vaccines. These involve some genetic material of the pathogen into another cell organism where that antigen is then produced. SARS, or severe acute respiratory syndrome, or also coronavirus. In this case, a synthetic mRNA tells the body to create spike protein, or SARS-CoV-2 virus, which triggers the immune system to produce cells to fight spike proteins. There could also be an adjuvant. This is an aluminum salt added to increase the body's immune response. And I certainly hope YouTube has stopped flagging my videos that anyone that mentions COVID. It's been a while now. We can stop. There are a long list of vaccine preventable diseases, everything from anthrax, diphtheria, hepatitis A and B, which is a common one to know, especially when it comes to ATI and NCLEX, which hepatitis have a vaccine available. And the answer is A and B. You're going to see that come up a lot. When providing vaccine recommendations, the CDC vaccine information statement contains everything from the route of administration, the schedule for the administration, the minimum dosing intervals, the contraindications, and standing orders for administering these vaccines. Some immunizations may also be necessary for international travel, everything from MMR, typhoid, yellow fever, rabies, and hepatitis A and B, just to name a few. When dealing with vaccine safety, there could be everything from mild reactions with injection site swelling and low-grade fever, and contraindications for vaccines, such as moderate to severe illness, anaphylaxis, and it's the healthcare providers responsible for reporting vaccine preventable diseases, as well as any adverse reactions. In the case of the varicella vaccine, there's going to be a seroconversion, where there's an acquisition of that detectable antibody levels in the blood. There's also going to be side effects such as injection site reactions, fever, rash, on up to anaphylaxis, and even Stevens-Johnson syndrome. The contraindications are going to be moderate to severe acute illness, anaphylaxis, active untreated tuberculosis, and high doses of systemic steroids. Future developments in vaccines include everything from, again, anthrax and smallpox, pertussis, herpes zoster, rotavirus, HPV, and bacterial meningitis. When using our clinical judgment for vaccines, we want to obtain an accurate medical history, determine any history of pregnancy or even the possibility of pregnancy within the next month, and a complete allergy history. We also want to document the vaccination date, route, and site of administration, along with the vaccine's type, manufacturer, lot number, and expiration date. We also want to carefully observe the patient afterwards for any signs and symptoms of an adverse reaction. For practice question 1, what kind of immunity is it called when newborns receive immunities via the transfer of maternal antibodies across the placenta? That be A, natural passive immunity, B, acquired passive immunity, C, natural active immunity, or D, acquired active immunity? That answer is going to be A, natural passive immunity. Before administering the varicella vaccine, which allergy is it most important for the nurse to assess the patient? That be A, penicillin, B, eggs, C, neomycin, or D, milk? That answer is going to be C, neomycin. For practice question 3, which of the following statements about herpes zoster vaccine does the nurse identify as being true? That be A, it's indicated for the treatment of patients at age 40 years. B, it is a live attenuated vaccine. C, it should be administered every other year. Or D, it prevents zoster in 90% of the people who receive the vaccine. And that answer is going to be B. It is a live attenuated vaccine. For our final question, which is the first vaccine developed to prevent cancer? That be A, rotavirus, B, pneumococcal disease, C, meningococcal disease, or D, human papillomavirus, HPV. And that answer is going to be D, human papillomavirus. But anyway, that's all we got for this chapter. I'll see you in the next slides.